Adjuvant therapy refers to additional cancer treatment given after the primary treatment to reduce the risk of cancer recurrence. For patients diagnosed with benign mesothelioma tumors, the main treatment is typically surgical resection of the tumors. However, adjuvant therapy may sometimes be recommended after surgery to destroy any possible remaining cancer cells and micrometastases that could lead to future cancer recurrence. The main types of adjuvant therapy used for benign mesothelioma include chemotherapy, radiation therapy, or immunotherapy. Here are some of the most common side effects patients may experience from adjuvant therapy after surgery for benign mesothelioma. Fatigue is one of the most common side effects that patients report with adjuvant chemotherapy, radiation therapy, or immunotherapy used to treat benign mesothelioma. The added cancer treatments can be an additional physical strain on the body as it recovers from surgery. Fatigue may range from mild to severe tiredness that does not go away with rest. It can impact patients' ability to do normal daily activities. Fatigue usually develops within the first few weeks of starting adjuvant therapy but can last for months after treatment ends as well. Nausea and vomiting are also very common side effects of adjuvant chemotherapy used to treat benign mesothelioma. Which chemotherapy drugs are used depends on the specific regimen, but many have nausea and vomiting as potential adverse effects. Anti-nausea medications like 5-HT3 receptor antagonists are usually prescribed to help prevent and treat chemotherapy-induced nausea and vomiting. However, nausea may still occur in some patients despite prevention medications. Nausea typically develops within 24 hours after receiving chemotherapy and can persist for a few days. Loss of appetite and weight loss are also associated side effects of adjuvant chemotherapy and radiation therapy for benign mesothelioma. The nausea, changes in taste or smell, and fatigue caused by cancer treatment lower patients' desire to eat. Not consuming enough calories and nutrients can lead to unintentional weight loss during adjuvant therapy. Maintaining adequate calorie and protein intake is important for treatment recovery and regaining strength. Nutritional supplements may be recommended by doctors and dietitians. Low blood cell counts, known as cytopenias, are another common problem caused by adjuvant chemotherapy used for benign mesothelioma tumors. Chemotherapy works by killing fast-growing cancer cells but can also affect normal cells with rapid turnover like blood cells in the bone marrow. This can lead to low red blood cell counts, anemia, low white blood cell counts, leukopenia, and low platelet counts, thrombocytopenia. Close monitoring of complete blood count levels during and after chemotherapy helps detect cytopenias early so they can be treated promptly to prevent infections or excessive bleeding risks. Growth factor support medicines like G-CSF may also be prescribed to help stimulate blood cell production. Mouth sores, known as stomatitis or mucositis, can occur in some patients undergoing adjuvant radiation therapy treatment for benign mesothelioma involving the chest area. Directed radiation beams used for radiotherapy may injure the lining of the mouth and digestive tract. Mouth sores cause pain or discomfort with eating, drinking, and swallowing. Topical numbing gels, pain medications, and soft, bland diet may help provide relief from stomatitis side effects. Brushing teeth gently with the soft toothbrush and salt water or baking soda rinses also helps reduce risk of infection from mouth sores. Diarrhea is another common side effect of adjuvant chemotherapy for benign mesothelioma, especially with certain drugs like 5-FU. Increased loose or watery bowel movements may occur in some patients a few days after receiving chemotherapy treatment. Proper hydration, over-the-counter anti-diarrheal medications, and dietary changes like avoiding fatty or spicy foods help manage chemotherapy-induced diarrhea. Continued severe diarrhea needs to be reported promptly to the doctor for potential anti-diarrheal prescription medications or chemotherapy dose adjustments. Neuropathy refers to damage or changes to the nervous system. It can develop in some patients who receive adjuvant chemotherapy treatment for benign mesothelioma tumors. Common symptoms include numbness, tingling, burning or sharp pains that may affect the hands, feet and sometimes face. The neuropathy may begin gradually during treatment and worsen before gradually improving over time after ending chemotherapy. Medications like gabapentin can be used to help manage painful neuropathy symptoms during and after treatment. Hair loss is a potential side effect of certain adjuvant chemotherapy drugs used for benign mesothelioma tumors. Hair on the scalp slowly thins out and may fall out completely a few weeks after chemotherapy treatment begins. Hair loss is usually temporary and normal hair growth returns after ending chemotherapy, although new hair may be different in color or texture. Wigs, hats, and head coverings can help patients with hair loss feel comfortable psychologically during cancer treatment. Memory and concentration problems, known as chemo brain, may sometimes occur as side effects of adjuvant chemotherapy or targeted therapies for benign mesothelioma. Issues like trouble recalling words, names, or short-term information, mental fogginess, and challenges multitasking can arise. Most cognitive symptoms are temporary and resolved within months of ending treatment, but some long-term effects have been reported rarely. Stress management techniques like yoga may help manage chemo brain. In addition to these common acute side effects, some adjuvant therapies for benign mesothelioma also carry risks of potentially long-lasting side effects or late effects down the road that require close monitoring. These may include risks of developing heart disease from certain chemotherapy drugs, lung damage after radiation therapy, or other risks depending on the specific adjuvant treatments received. Overall, communication between the patient and medical oncologist is important to properly manage any side effects that occur during or after adjuvant therapy for benign mesothelioma tumors to maximize treatment response while maintaining quality of life as much as possible. Adjuvant therapy can help further reduce risk of recurrence after surgical resection of benign mesothelioma tumors. However, chemotherapy, radiation therapy, and immunotherapy used adjuvantly do carry risks of short-term and sometimes long-term side effects that require monitoring and management. Understanding potential side effects helps patients better cope with treatment. With proper support and self-care, the side effects of adjuvant therapy for benign mesothelioma can usually be effectively